Bismillahirrahmanirrahim. So today's MCQs from the second substage of the lower limb shall involve the muscles of the deep layer of gluteal region. So let's see the first MCQ. It reads that which of the following muscles serves to separate the superior gluteal nerve and vessels from inferior gluteal nerves and vessels? Now, this question is peculiar in the sense that it is asking you basically the surface landmarks related with the lower limb. So you must remember the different surface landmarks that are easily found on the body or in the deeper dissection, and they act as landmarks during the deep dissection of the lower limb. University of Health Sciences, again, I am emphasizing on the fact that University of Health Sciences does not leave any corner diagram, any corner heading given below the diagrams, charts, flow sheets, or even the tables when it comes to MCQs and SCQs. So in that sense, the University of Health Sciences is quite an unpredictable university. So never leave any single corner, single line of your textbooks recommended by the University of the Health Sciences, and always give a thorough read and practice MCQs at the end of each topic covered. Especially during the demonstrations, as well as your embryology and histology and GA lectures. So make it a habit of solving MCQs. MCQs not only help you to quickly revise or go through a topic that you have taken lecture on, and also they make your reflexes when it comes to solving the MCQ. So since the time assigned by the University of the Health Sciences in professional exams is 1 minute per MCQ. So my advice to the medical students usually is always allot 30 seconds of your time, 1 minute, from the 1 minute, 30 seconds. Spend those 30 seconds reading the stem of the question very carefully and pay attention to what is asked in the question. Usually most of the students, they are good students, but they incorrectly attempt the MCQs because they do not pay attention to the stem of the question, either due to the anxiety or nervous levels or simply in a hurry because time is limited and allotted. So always make it a habit of spending 30 seconds from the 1 minute to read the question carefully without getting anxious or becoming worrisome. Fine. So no need. It's quite easy to pass the exams in the University of Health Sciences. You just need to pay a little bit of attention and be focused and control your anxiety and nervous levels and do not be in a hurry. So which of the following muscles? Here in this question, you are asked about a very important landmark that is present or can be seen in the gluteal region during the deeper dissection. And this landmark is very important not only from the clinical point of view, but also it helps out the surgeons during surgeries, anatomists during dissections, and students during the spotting exams. So, which of the following muscles serves to separate the superior gluteal nerve and vessels from inferior gluteal nerve and vessels? Following are the options: piriformis, superior gemellus, obturator internus, inferior gemellus, and quadratus femoris. One of these muscles serves the function of an important landmark in the region of the gluteal region. So I hope you must know this muscle. So next question reads, the fibers of the piriformis muscle run in which direction to exit through the greater sciatic foramen? Now, most of the students, they will realize or they will say or think that it's such an unimportant question to ask. It's an unimportant point to be asked in a question. But again, beta, University of Health Sciences loves to give you lines from their textbooks, recommended textbooks. Regardless of the subject, whether it's anatomy, physiology, biochemistry, or whatever year you are in, University of Health Sciences has a fixed rule for, especially when it comes to MCQs. They literally give you lines from their recommended textbooks. So please, beta, no need to get anxious that how are you going to cover it. You just need some time and be focused and develop a strategy, right? But that again, strategy is useless when you have not gone through your books, recommended textbooks by the UHS thoroughly. So fibers of the piriformis muscle run in which direction to exit through the greater sciatic foramen? Upward and medially, upward and laterally, downward and medially, downward and laterally. Now, you must remember the relation of the origin and distal attachment or insertion of the piriformis. From where does it arise? Where is that attachment located? And distal attachment is located where? So you must know the relationship of those two attachments when it comes to piriformis muscle and this question. Question number 6 reads, which of the following muscles is a fan-shaped muscle? Now, what University of Health Sciences has started very recently, that they have started to merge the questions from general anatomy with the gross anatomy. So you actually cannot leave any corner from the general anatomy books, even though it's a very small subject, and it comprises of some general knowledge facts related with the general anatomy covering all of its branches. But what they have come up with is a trick. They have actually merged the general anatomy with the gross anatomy, especially in the first year, obviously, because general anatomy is part of syllabus of first year MBBS. So you cannot actually separate the two. Which of the following muscles is a fan-shaped muscle? Now you must know the shapes of these muscles: piriformis, superior gemellus, obturator internus, inferior gemellus, quadratus femoris. Now you have to read or go through your books, either of the general anatomy or gross anatomy. This is the question whose answer can be given in the general anatomy, or it may not be given in general anatomy, but it may be present in the recommended textbooks of the gross anatomy. Question number 7. Lateral border of the ischial tuberosity gives origin to. Again, a very straightforward question. No least likely options, no not option, no exclusion. Again, a very straightforward question. You have to pick up the muscle or right option that arises from the lateral border of the ischial tuberosity. So again, it is one of those questions where University of Health Sciences likes to put lines of the recommended textbooks into the MCQs. So which of these muscles arises from the lateral border? Is it piriformis, superior gemellus, obturator internus, inferior gemellus, quadratus femoris? Again, note down a very important point. Origin and insertion are usually least likely to be asked in the SCQs, but they become an important component of the university exams when it comes to MCQs. So obviously, yes, you cannot leave anything out of your preparation when it comes to final prof of first year MBBS. Next question is nerve to quadratus femoris supplies. It's a very tricky question because nerve to quadratus femoris supplies at least two muscles. One is of the same name, that is quadratus femoris, and then there is another one. And you have to pick that another one from the mentioned options. Is it either piriformis, superior gemellus, obturator internus, inferior gemellus, obturator externus? And you can apply the exclusion strategy when it comes to pick up the right option. So all the best.